Why is the US building an Ebola quarantine facility in Kenya? Imagine being told that a foreign government does not want potentially exposed Ebola patients entering their own country, but they are comfortable setting up a quarantine facility in your country instead. That is the question many Kenyans are asking right now after reports emerged that the United States administration plans to establish an Ebola quarantine facility in Kenya. But why Kenya? Why not the United States itself? Why not Congo, where Ebola outbreaks have occurred before? And what risk does this pose to ordinary Kenyans? And honestly, many people are asking one simple question. If the United States has some of the best healthcare systems in the world, why not quarantine their citizens inside America? Why Kenya? Supporters of the plan say Kenya was chosen because it is considered a regional hub in East Africa. They say that Kenya has major international airports, relatively advanced medical infrastructure, stable transport system, and also a strong partnership with international healthcare organization. So from a logistical standpoint, officials may see Kenya as a strategic location, but critics say that explanation is not enough. Because of many Kenyans, it feels like the risk is being shifted away from America onto an African country. And that is where this debate becomes bigger than just Ebola. It becomes a conversation about power, influence, and whether African nations are sometimes treated as convenient solutions for problems wealthier countries do not want handled on their own soil. Now let's be clear. A quarantine facility is not the same as releasing Ebola into the public. Ebola spreads through the direct contact with bodily fluids from infected individuals. Modern containment systems are specifically designed to prevent the outbreaks. However, people are still worried because no system is perfect. Accident can happen. Human error can happen. And many citizens feel that even a small possibility of exposure is too much risk for a country that currently has no Ebola outbreak. Others are questioning whether the Kenyan public was properly consulted before such discussions took place. Should decisions with such serious national implication happen behind closed doors, or should citizens have a voice? At the end of the day, this conversation is not only about Ebola, it's about trust, it's about transparency, it is about national sovereignty, and it is about whether ordinary citizens are fully informed when decisions affecting the public safety are being discussed. The biggest question remains: is Kenya being treated as an equal partner in global health cooperation, or a convenient location for managing risk other nations would rather avoid themselves? What do you think? Should Kenya allow such facility, or should the US handle quarantine operation within its own borders?